Hi, my name is Patricia Anderson, and today I'll be discussing four topics: client confidentiality, informed consent, clients turning 18 while in treatment, and parental notification. First, let's talk about client confidentiality. As a leader, client confidentiality is extremely important, and especially if it requires you to handle sensitive or personal information about your clients. Maintaining confidentiality is essential for building trust and establishing a strong professional relationship with your clients. When a client shares their personal information with you, they're placing their trust in your ability to keep that information confidential. Breaching that trust can not only damage your relationship with that particular client, but can also harm your reputation and credibility as a leader. Next, we'll talk about informed consent. Obtaining informed consent in the workplace is essential for several reasons. One reason is respect for autonomy. Informed consent allows individuals to make their own decisions about their involvement in workplace activities. It is a way of respecting their autonomy and ensuring that they are fully informed before consenting to participate in any particular activity. This goes along with a workplace situation, such as being voluntarily involved in a group session or a project without knowing. Also, in a mental health setting, that they know that you're going to keep that confidential, and trusting each other in an organization as far as supervisory aspects that can keep private stuff to themselves without showing it to the rest of the department, so they can keep that confidential and build trust at the same time. Also, risk mitigation. Obtaining informed consent can help mitigate risks and protect both the employee and the employer. By disclosing the potential risks associated with a particular activity, the employee can make informed decisions about whether or not to participate. This can help to prevent workplace injuries or other adverse outcomes. For example, I had an employee once who volunteered to help move desks and take apart cubicles. That was not in his role or job description. He was an advanced medical support assistant doing computer work and processing authorizations. He wanted to be part of the team and help the other staff members move their office around. I had to inform him about the potential risks and injury, and he agreed that it was not a good idea because of prior back injuries. And so that was a good thing that I mentioned that, and he was able to, bail out without feeling too embarrassed, but he understood the risks that were involved. The next one is legal compliance. In some situations, obtaining informed consent may be required by law. For example, in medical research or clinical trials, obtaining informed consent is a legal requirement. And trust and transparency. Obtaining informed consent can build trust between the employer and the employee by demonstrating a commitment to transparency and openness. Employees are most likely to trust their employer if they feel that they've been fully informed about workplace activities and have had the opportunity to provide consent for anything that they're going to be involved in. Next is when clients are turning 18 while in mental health treatment. This is important because when they're a minor under age 18, things are a little different than when they become a full adult and responsible for their own decisions and their health care. When a child turns 18 receiving mental health treatment, several changes may occur. One is legal autonomy. Once a child turns 18, they are legally considered an adult and are responsible for making their own decisions about their mental health treatment. And this means that they have the right to consent or to refuse treatment, and they can choose to discontinue treatment at any time. Privacy. With legal autonomy comes the right to privacy. Once a child turns 18, their mental health information is protected by laws governing medical privacy. And mental health professionals cannot share information about their treatment without the parent's consent, except for in certain circumstances such in a cases if they have suicidal ideations and they are trying to do self-harm or harming others. Insurance. Depending on the terms of the insurance policy, a child may no longer be covered under their parents' health insurance once they turn 18. This can impact their ability to even seek health services, which can affect their overall well being. And their transition to adult services means that the mental health services for adults may be a little different than children and adolescents. The child may need to transition to a different mental health professional or a different treatment program that specializes in adult mental health. And responsibility for treatment. Once they turn 18, they become responsible for their own mental health treatment. And this means that they may need to schedule appointments, refill their own medications, and manage their own treatment plan. Whereas before, their parents might have been highly involved, and now their involvement is not necessary. And last is, what is ethical practice when needing parental notification? Ethical practice when needing parental notification involves balancing the principles of confidentiality and autonomy with the need to protect the safety and well-being of a minor. In general, the ethical practice when needing parental notification might involve informed consent. Mental health professionals should provide clear and appropriate information to minors about the nature of their treatment, the benefits as well as the risks, and the limits of confidentiality. The minor should be given the opportunity to ask questions and provide informed consent before treatment begins. Confidentiality. Mental health professionals should make every effort to protect the privacy and confidentiality of minors. However, there may be circumstances where confidentiality must be breached, such as in cases where the minor is at risk of harming themselves or others. And last, parental involvement. Mental health professionals should involve the parents or guardians in the minor's treatment to the extent that it is necessary to ensure the safety and well being of the minor. This may involve notifying parents of their child's treatment or seeking parental consent for certain treatments or interventions. Thank you.